is done until you push the button again. There's a roller switch right here. This roller switch serves several functions. It is your on and off switch for the unit. It also turns on your battery test light, and it also acts as a way to vary the intensity of the current. So if you're in the middle of a treatment and it feels like it's too much, you can back it down a little bit. Or if you feel like you need a little more, then you can turn it up. So I'm going to turn it on to show you guys something. So I've got it on. You can hear it's making a sort of a beeping noise, a steady tone. If I flip it over, there's a place for a light right here, and you'll notice that that is not lit up. So it should look like this. You can see the green light there, but it doesn't. So when you turn the unit on, always turn it over and check this light. So that is not green. Your battery is pretty well getting ready to go dead. So we're going to go over right now how to change the batteries. And a very important customer service announcement, because one of the major complaints I get from the customer service department of the company is that people call them regularly having done the following thing. They decide to change the battery, and they look at the unit and they see these nice little screw holes at either end. And they take a screwdriver and they take the screws out of this and take it apart. And when you do that, everything on the inside of the unit dumps onto your table. And then you have to send it. Number one, you void your warranty. Number two, you have to send it back to us. And number three, they get angry at me for not telling you guys there's a battery compartment right here. So this is how you use it. You can use a coin, you can use a knife, you can use a screwdriver, but you're going to pop this little battery compartment open like this. And inside you will see there's a standard 9-volt battery. Now, to change it, you're just going to give it a little tap. You're going to pull the 9-volt battery out. You'll notice this is a Panasonic battery. It comes stock with Panasonic batteries. However, there are 3 types of batteries that we recommend for these devices. We recommend Panasonic batteries. Good luck finding those. We recommend Energizer batteries. Those are easy to find. And we recommend Duracell batteries. And those are also easy to find. So why do we recommend these 3 batteries and nothing else? Well, there are 2 reasons. The first of which is that you will notice that this compartment does not have any wires. Normally things with 9-volt batteries have a little pad and some wires, which is also a customer service nightmare because those things always break. Then they have to get sent back in. So we decided to design this with a compartment on it that doesn't have any wires. So the battery compartment is a certain size. As luck would have it, all AA batteries are the same size, all AAA batteries are the same size, all C batteries are the same size, and all D batteries are the same size. But 9-volt batteries come in different sizes. Some are a little bit shorter, some are a little bit longer. So if you put a battery in here that's too small, it's going to wiggle back and forth in there, and you're going to get intermittent contact, and it's not going to work very well. And if you put a battery in here that is too long, there's a plastic post in here that protects the circuit board. You can actually break that post and damage your equipment. So if you stick to these 3, you'll be good. If you find another battery that fits, please, for the love of God, do not use cheap dollar store batteries, because those have a tendency to dump all their voltage at once, and it can damage your circuit board. So in short, Energizers, Duracells, and Panasonics, and you're good. Okay. With that being said, we're going to take one of our handy dandy batteries here. There's a little chart in here that shows you how it goes in. Got to slide this in here. And when you go to put this cover plate back on, it is a tight fit. So it's going to feel like it's going to break, and it's going to make a loud snap when you put it back together. I promise you it's not going to break. It's just a tight fit so it doesn't rattle around in there. Okay. So once you've done that, you will pick up your Dolphin Neurostim, turn it on, make sure you got a green light there. When you have that green light, you're good to go. All right. So this roller switch serves to turn the unit on. The more I roll it, the more intense it is. The green light is going to stay the same on this side, except for some other features we're going to show a little bit. And now with the unit on, if I push this black button on the back, you will hear the unit beep, and you will see a flashing light on the front. Don't pay too much attention to the flashing light. I'm just pointing out to you that's working. You'll notice that as long as I hold this button down, it makes a beeping noise. When I release that button, it stops beeping, which means I am no longer doing a treatment. There's a small black button above here. This black button puts the unit in a constant treat mode. So there is a timer in here. So when I turn it on, it goes into a silent mode, so it doesn't make any noise. But if I flip it over, you'll see that it's blinking. So it tells me there's something going on there. So this will run for anywhere from 11 to about 13 minutes. It really depends on the strength of your battery. So it basically counts the number of electrons that go through the device, and then it shuts off. So if you have a stronger battery, it'll be more like 11 minutes. If you have a weaker battery, it'll be more like 13 or 14 minutes. But either way, it goes for a little while, and then it turns itself back into what we call the search mode, and you'll get just a steady green light, and it will make just a noise like this. Okay. So that comes in handy when you're doing things like vagus nerve stimulation. Most of your other treatments, you're going to use this button and not really worry about it. So moving to the back of the Dolphin Neurostim, I'm going to turn this off. You're going to see a metal plate right here. When you are doing treatments, unless you are putting a special electrode on there, like one of these little electrodes like this, unless you are putting one of these on the back of here, you must touch this metal plate to do a treatment. If you are not touching that metal plate, you are not completing the circuit. And what you're basically doing is holding a really expensive acupressure tool. You're just pushing on points, okay? So you might as well get a pencil at that point. So make sure you're touching this. We do recommend that when you hold this, don't try anything weird or funky. This is a very simple device. So if you try and hold it like this and do some weird thing, it's going to look weird and it's going to feel weird. But if you put this in your hand like you're holding a pen or a pencil, so that my thumb is on that metal plate, and the back of this rests right here in the hollow between my index finger and my thumb, gives you a nice little tool to be able to move around and find points. And you can rest the heel of your hand on yourself or your patient, whoever you're working on. It acts as a fulcrum, so you have fine motor control. So that is a recommended way to hold these. Any other way you decide to hold it, you're kind of on your own. Okay. From there up, you'll notice there's a slider switch here that says wet, normal, and dry. So that has to do with how sensitive the ohm meter is on this device. This device will actually find acupuncture points, myofascial trigger points, and motor points. It does that by measuring how conductive your skin is to electricity. But as you notice, some people have very dry skin. Some people have very moist skin. The wetter your skin is, because that's salt water, the more conductive your skin is to electricity. So this finds points by measuring how conductive the skin is. And when it finds the most conductive point, it goes off and it lets you know that you're on the point. But if your skin is already really moist, it's going to have a hard time finding those points because everything is pretty conductive. So you want this to be a little less sensitive. So you would put it on the wet setting. But if you are somewhere like up in Canada, I live down in Georgia in the States, it's always hot and muggy down here. So I usually keep it on the normal setting. But if you're somewhere like in Canada and it's the wintertime, everybody's skin is dry, it's not going to be as conductive. So in that case, you want to put it on the dry setting, which makes the ohm meter a little more sensitive. Now, when you first start playing with this, if you're trying to learn how to find points with this, it's often easier to put it on the dry setting because it's more sensitive. But as you get a little bit of practice, start backing it off to the normal setting, and that'll be a little bit better for you guys. It'll make sure you have better point location, and the more accurate your point location is, the better your treatments are going to be. Luckily for you guys, even though we treat acupuncture points, this is not like having a needle. You don't have to absolutely nail the point because it's electricity. If you get pretty close to the point, you're going to get a pretty good outcome. But the closer on the point you are, the better your outcome is going to be. All right. Moving up from there, you will see a little switch here, slider switch that says polarity, and you will see a minus symbol, a plus symbol, and a plus minus symbol. So in the world of acupuncture, you are going to be trying to either tonify or sedate things, which means you're either bringing things up or bringing things down. That's part of the basis of acupuncture. If it's too much, you bring it down. If it's not enough, you bring it up. 99% of the things you guys are going to be treating are going to be what we call conditions of excess. And conditions of excess are things you want to bring down. So here's a short list: headaches, tight muscles, trigger points, nerve pain, migraine headaches, asthma attacks, constipation, diarrhea, nausea. Like the list kind of goes on and on and on. So autoimmune diseases, like take your pick. Most of those are things you want to bring down. However, every once in a while, there's a condition that you need to bring up a little bit. So an example of that would be something like Bell's palsy, where somebody's face is all droopy. In that case, you want to tonify that area. You want to bring it up. So you would put it on the plus setting to bring that area up a bit. Now, the good news is if you get the polarity wrong, you're probably still going to get a good treatment. So you can't really screw this up. You could just have a better treatment. So just by virtue of stimulating the points, you're probably going to get a pretty good outcome. the better your point location is and the better your choice of polarity is, the better your outcomes are going to be. Now we have this little thing over here, this little plus minus symbol, and you're going to use that primarily when you're treating scars. It's about the only time you're going to find yourself using that. So that gives you a biphasic current on this device. So this device is direct current. So with direct current, it generally flows in one direction. So on the negative setting, electrons flow out of the tip of this device. On the positive setting, electrons flow out of the metal part of this device into your finger, down into the patient, and come back up through the tip. So it draws current to that area. So it brings it up. Okay. So what am I looking for here? Oh, I know what I'm looking for. So if you look at the manuals that typically come with these devices, so I'll show you a couple examples. There's the natural health book that comes with the device on any given protocol. So let's look at pelvic pain. You'll see that these points down around the ankles, you got spleen 6 there and kidney 3. And you'll notice that each of these, any of the points marked on any protocol is going to have a symbol next to it. In this case, it's minuses. You guys see that little minus symbol? So that corresponds to the settings here. So with all of our protocols, we're always going to tell you what polarity to use. Again, vagus nerve recovery book, if you have the vagus nerve kit. If I open to any random part of here that has some acupuncture points marked in it. Let's see here. Here's one, conceptual vessel 12, liver 13. You'll see those are both on negative, a little minus symbol by it. Here's another book we have. This is for horses. So let's find one in here. Let's see. For relaxation before a race, let's see. Most of those, again, are negative because you're trying to bring things down. Okay. If you had a patient who had like really bad, let's see, like their adrenals were really shot, like just had no energy all the time, you were trying to bring up their adrenals a bit, that's a case where you might use positive. But here again, like as long as you get the points right, if you screw up the polarity, it's probably going to be okay. All right. So that's going over how to use all the little features on here. The batteries will last. I use these devices. 3 days a week, I do 10 hours straight through. So that's 30 hours of treatment right there. And then the other days, I probably do another, I don't know, 10 to 15 hours of treatment. And so of those treatments, probably about 20 minutes of the treatment is using this device. And so a battery lasts me about a month or so before I have to change it. So the battery should last a good long while. Now, if you're doing vagus nerve stimulation every day, your times may vary a little bit, but you're going to get some pretty good time out of that, especially if you use this little timed feature on here. So what we had in the past with some of our older equipment is that people would use the equipment, turn on the vagus nerve stimulator, and it would just run all night long because they would fall asleep with it. And then they had like 6 hours of vagus nerve stimulation, would wake up really groggy the next day. So we decided to put this little timed feature on here for you guys so that you don't overtreat yourselves. Okay, so what do we need to do next? We need to teach you guys how to find an acupuncture point. So let me look in one of these books here and find a couple of points that are easy for you guys. All right, let's see. We have here, here we go. So on the vagus nerve recovery book, I'm on page 12. You will see there are some points here. There's one on between the index finger and the thumb called large intestine 4. And you will see one there is right in the crease of your elbow called large intestine 11, designated by LI11. You'll notice that they both have a negative by them. So I'm going to show you guys how to find those points using the device. So let me grab a handy dandy marker of some kind here that you guys can see on my skin. Let's see here. All right. So large intestine 4. So I got my thumb, got my index finger. Everybody's probably heard like, hey, if you have a headache, rub between your index finger and your thumb, and that'll make it better. But most people rub in the wrong place. They rub in the little skin part right here. You really have to go up a little bit higher into the meat right here. It's actually kind of up in the muscle. So if you take your hand and squeeze your index finger and your thumb together, you'll see that a little mountain comes up here, kind of right at the top of that mountain is where the acupuncture point is. So I'm going to mark that on my hand. so you guys can see about where it should be. So I've got a little X right here. I'm going to turn the Dolphin Neurostim on. I'm going to put it on the negative polarity, and I'm going to put it on the normal skin setting. I'm going to turn it on. I'm going to make sure I have a nice green light here, which tells me my battery is good. And, excuse me, allergies. And I'm going to have my thumb on this metal plate. Okay. So what I want to do is I want to, not pushing too hard, I want to gently, and I'm going to roll this around and hold this the wrong way so you can see it. I want to gently pull this across my skin. And as I start doing that, you can hear the tone change a bit. You guys hear that? Starts making weird noises. And then when I get on top of the point,
the light goes out.
Light goes out and the pitch goes way up. You'll hear a real high pitch. Okay. So at that point, I've found my treatment point. So again, with my thumb on this metal plate, I'm going to hold the button down and it's going to start beeping. Now, there is a tendency to want to watch the light while you're doing a treatment because it's just entertaining to see it beep. But I will tell you that if you want to frustrate yourself, just keep watching that light because sometimes that light will be on and sometimes that light will be off. And then you'll wonder why. And you're going to go down all kinds of rabbit holes trying to figure out why. And the final answer is it doesn't matter. This is exactly 2 times when you want to look at the light on this device. Okay. Don't look at it any other time because it's going to bring up a million other questions that are just going to drive you nuts. And trust me, we've explored all the possibilities. This device has been around in one form or another for probably 25 years or so. Okay. So we kind of worked out all the bugs. When you turn this device on, I'm going to see if you got a nice green light. And if you see that, your battery's good. That's number 1. Number 2, when you are finding acupuncture points, you want to see that light go off. When you're on the point, light goes off. When you're off the point, light is not off. On, you got the light going off. Now, when you are looking for points, I'm going to give you a hint. If you push too hard with this device, you're going to compress the skin. If you compress the skin, it becomes more conductive to electricity. So I'm just going to pick some random points in my arm here, and I'm going to push really hard, and we're going to see what happens. Ooh, look, the light went off. Ooh, light went off again. Ooh, light went off again. Light went off again. Those are not all acupuncture points. I'm just pushing so hard. I'm getting the tip of the unit closer to the conductive stuff underneath. So what's happening is it's registering a false positive. So when you go looking for points, it's important that you choose the right skin type and that you also use this slowly. So I recommend keeping the heel of your hand down on whatever you're looking for. So you have to touch this, then you have to have skin-to-skin contact with your patient. Now, if I'm the patient, I don't have to do some weird thing and touch myself because I'm already touching this, okay? So don't think you have to do anything odd. But if you're treating someone else, if I do just this doesn't do anything. I have to have skin contact with them somewhere, okay? I can't touch their shirt. I can't touch their hair. Like, it's got to be skin-to-skin contact. It doesn't matter where the skin-to-skin contact is. I can stick my finger up their nose or stick it on the back of it. It doesn't matter. It's just got to be skin-to-skin contact because the electricity has to complete the circuit. So we want to be able to complete that circuit. The more skin contact you have, the better. So when I first got started with this, we had devices that you couldn't turn them up or down. You just touched the patient a lot or you touched them a little bit. And the more you touch the patient, the more electrons would flow through them. And that's how you regulated the intensity of it. Thankfully, you guys now have a nice little rolly switch that makes it way easier. Okay, so when I'm looking for points, I want to touch this down and I want to have the heel of my hand here for A, for skin contact, and B, because it provides a nice fulcrum for me to be able to do fine motor control work. And I can gently move this around while I'm looking for my point. So there I've got my point. So that's the first point. So we're going to do one more and then we're going to move on to treating scars. So I'm going to pull this down a little bit so you guys can see my arm here. And we're going to go to the end of this crease right here. There's an acupuncture point called large intestine 11. So we're going to put a little black dot right there on it. So you can see that right at the end of that crease. We're going to turn the device on. Make sure we got a green light. There's a green light. Touch my thumb to the metal plate. Drop my hand down so that I have a fulcrum. And then I'm going to gently make little circles around this area while I look for the point. And I'm going to turn it so you can see it. Once I'm on the point, the light goes off. Okay, so that's your indicator. Now, sometimes you will get somebody who has really, really dry skin. It's so dry that even when you put on the driest setting, it's difficult to find points. In that case, I recommend taking a paper towel like this, folding it up, dampening it with a little bit of water, wipe it over the area, and then dry it off. And that will hydrate the skin enough that you can locate your acupuncture points. You can't leave it wet, but you've got to just get most of the water off. And that'll help you guys out a little bit. This is a good device, but it does have limitations. Okay. So it's a very accurate point finder. So that is how you go about locating points. It doesn't matter what the protocol is. If you have any questions about what polarity you should use, just default to the negative polarity. That's going to be 99% of what you guys use. And if you happen to treat a point on the negative polarity, and for whatever reason, it makes that pain more intense after you're done, is that good or bad? Well, it's bad that you feel a little bit worse, but it's good because we know that you have a point that's affecting the area. So if you have a point that on negative polarity makes an area worse, if you put it on the positive polarity and go back and retreat that same point, it will typically make it better. You just have the right point but the wrong polarity. So every once in a while, the polarity will aggravate things a little bit, but most of the time it just calms everything down. Okay. So next thing we need to talk about is how to treat scars. So I've been using this modality for almost 25 years now. I've been a therapist for 30, and I've used this tens of thousands of times. I've worked in neurology offices, neurosurgery offices, women's healthcare offices, physiatry offices, and some with chiropractors. And in all of those cases, I've used this extensively. And one of my favorite things to do with this device is to treat scars, because nothing else out there treats scars as well as we do. And trust me, I've either seen it or tried it. I've done entire weekends on manual therapy for scar release. What you learn for those thousands of dollars that you spend and what you can do with this in 30 seconds is crazy. Like, it actually really hurt my feelings the first time I released a scar with this, because I realized I had not really been wasting time, but I was using things that were very inefficient at changing scar tissue. So the deal with scars is that scars have odd mechanical, really odd electrical and chemical properties. Okay. Normal body tissue is negatively charged. Scars are positively charged. Normal body tissue holds a resting charge of about 80 millivolts. Scars hold a resting charge of somewhere around 1.6 volts. And even though it holds a higher resting charge, scars don't conduct electricity well. So they're basically non-conductive. They're non-conductive electrically. And if you can repolarize that tissue, shift it from a positive polarity to a negative polarity, it changes the scar tissue in such a way that it makes it less dense. Okay. So to be clear, you will never get rid of scar tissue. Once you have scar tissue, you have it. However, you can modify the consistency of it. So if you use this device, it will permanently change the density of the scar. And what we know from doing ultrasound studies, scientifically based ultrasound studies, is with each treatment, we get about a 20% reduction in the overall density of the scar. Sometimes it's a lot more, but you can expect at least a 20% reduction in the density of the scar. When the scar becomes less dense, what effect does that have? Well, nerves start deep and they come to the surface. So if the scar is binding around nerves that are going up to the surface of the skin and causing a lot of pain, it will release that. So that's a positive, right? So scars can be painful. So it helps with painful scars. Scars can also restrict range of motion. A lot of times you'll see people who've had open heart surgeries or mastectomies or breast reconstruction or breast augmentation, whatever, and they have all this pain up in here in their upper back. So if you release any of these scars, it relieves that pain, because your entire body is covered with a network of connective tissue called fascia. Okay, it's like a body stocking. And if you pin it down anywhere, it's going to pull everywhere else around the body. I saw a patient one time, the guy had a frozen shoulder. He couldn't move his arm. And he had all kind of therapy on his shoulder, had injections and all kind of stuff. So when we got him, turns out he had had a hip replacement surgery about a year prior. Nobody bothered to look at that. So it was actually pulling all the way up, like somebody pulling down on your shirt. So it was pulling down so hard that when he tried to move his arm, he couldn't. So when we released the hip replacement scar, his shoulder moved fine. He didn't have a shoulder problem. He had a scar problem affecting range of motion somewhere else. So knee replacement scars, hip replacement scars, open heart surgery scars, brain surgery scars, C-section scars, hysterectomy scars, mastectomy scars, even scars where they just put little tiny holes in you, like gallbladder scars, and suck your insides out. Like there's still scar tissue down in there. And anytime you have surgery in this area, you are prone to getting abdominal adhesions. So one abdominal surgery, you have an 80 to 85% chance of getting abdominal adhesions. Two abdominal surgeries is 100%. I don't care if they cut you or poke holes in you. Your insides get really freaked out when they're threatened to become your outsides. So your body lays down a bunch of scar tissue to hold everything down, which is good because you certainly don't want your gallbladder outside your body. But the problem with that is it doesn't know when to stop. So it'll start growing scar tissue that binds around organs, pulls on things, will restrict range of motion, could cause swelling, all kinds of problems. Then you get into the people who have had surgeries for cancer, and now they have scar tissue over areas, and now they have lymphatic problems because the scar tissue is blocking the flow of lymph to get past that area. So you need to be able to release that. So if you're a manual therapist and you do any kind of lymphatics, you would want to do your scar work first with microcurrent. As a matter of fact, if you're any kind of manual therapist and your patient has any kind of scar whatsoever, you would want to do this first because it's going to affect every other thing you do. So other things that scars will do. Well, in the world of acupuncture, any scar that crosses a meridian, like this is a map of all the meridians on the body. So you can see there aren't too many places on the body where there aren't acupuncture meridians. Any scar that cuts one of those meridians is considered to block the flow of energy along that meridian, which creates an imbalance in the energetic system, if that's what you believe in. And very often, if you treat scars along the meridians, you will see effects in other places in the body. So that's an important one too. So lymphatics, range of motion, pain, other things. Scars can act like a battery. So 90% of your body, probably more than that, is covered by your sympathetic nervous system. So you've got all these little sympathetic nerve fibers around all over your body, and they control like microvascularization and sweating and things like that that have to do with your level of arousal. So because all those nerves are there, if you get a scar anywhere on the surface of your skin and it holds a higher resting charge in the surrounding tissue, what ends up happening is it acts like a battery and it hyperstimulates the local sympathetic nerve fibers. Not a lot, but a little bit. But a little bit 24 hours a day, 7 days a week. And over time, it actually winds up your sympathetic nervous system, which is your fight or flight response. So a little tiny scar from a childhood injury that is not painful, like on your knee where you skinned your knee as a kid, or one that people miss all the time, is right under the chin right here. I got mine where I fell on the steps at my grandmother's house, like right there. But those scars, those kind of scars, even though they're not painful, even though they're not causing swelling, even though they don't seem to be restricting range of motion, they can actually drive up sympathetic arousal. So a very old scar can actually make a new injury hurt worse. So when you release these older scars, it drops your level of sympathetic arousal, like it stops stimulating your nervous system and things start to calm down. I've seen people who have anxiety attacks that started about 9 months after surgery for no apparent reason. But apparently what was happening is the scar tissue itself was actually driving sympathetic arousal, and these poor patients started having anxiety attacks. I put on medicine and all kind of stuff. You go and treat the scar, stop the stimulation, and those things go away. So always look at scars when you have a patient who has nervous or has anxiety, and definitely chronic pain patients. Scars anywhere on the body are a good thing to look at. All right, so those are the reasons why you would want to treat a scar. So now we need to go over how to treat a scar. The best way for me to teach you guys how to treat a scar is to actually draw a scar on a piece of paper, and we're going to tape it to me. So we're going to pretend like I have had open heart surgery. So I've got my little nice open heart surgery zipper scar right here. And on one side, we're going to use the positive negative, which is the biphasic setting. And on the other side, we're going to use the negative polarity. So here we go. And just so we're fair, we got Democrats and Republicans, everything's all balanced there. All right. So let me grab a little bit of tape here. See if I can do this in such a way that it will make sense for you guys. All right, so we're going to tape this on my shirt right here. And here's my open heart surgery scar. And what you'll notice with people who have open heart surgery scars, they tend to have a lot of upper back and neck pain. It tends to hurt a lot because they split you open right here and spread your ribs. And, now you've got wires down in there and all kind of stuff. So to properly release a scar, you don't need one Dolphin Neurostim. You actually need 2 Dolphin Neurostims. One of them you're going to put on this biphasic setting, like this, like that. The other you're going to put on this negative setting, like that. Your choice of skin types doesn't really matter. We're not really looking for acupuncture points. Remember, I told you guys that scars don't really conduct electricity well. So if you start looking for points along a scar, you're not really going to find much because it doesn't really conduct electricity. And the reason you have to have 2 of these is you have to be able to push from one side of the scar and pull electrons through the scar. If you don't do that, you're not going to infiltrate the scar tissue with enough electrons to change it. So to be very clear, like this is a game of electrons. There are lots of ways you can treat scars. You can do skin rolling over a scar. You can use gua sha scraping tools over a scar. You can use cups over a scar. You can stick dry needles in a scar. You can draw up a syringe full of not Novocaine, but Procaine. Novocaine has the wrong electrical charge. You can use Procaine and inject it down through the scar so that the Procaine electrically changes the polarity of the tissue in there. So by far, the 2 most effective ways I have seen for releasing scars are A, microcurrent, and B, Procaine injections. And most of you guys can't do injections in people. And even if you could, start doing injections in this area and like see how far that gets you once you get around somebody's intestines or their stomach. So microcurrent is by far the fastest and safest way I know of to release scars. And it's fun because it works almost every single time. Like I rarely see it fail. My expectation is if you come in here with a painful scar, the first time I treat your scar, I will get at least a 50% reduction in pain, if not more. And that really only takes a few minutes to do. And the scars will visibly change, and they will change in the way they feel. Like if you have, I always say I take pictures of all my scars. Like I do a whole evaluation. But if you have your patient run their fingers over the scar and look at it, and then treat it and have them run their fingers over it again, they will notice dramatic changes in the scar. Like it's really, really fast. Okay. So I'm going to turn both Dolphin Neurostims on. I got nice green lights here, but now I'm not going to watch the green lights because I am not looking for acupuncture points. I got one on the negative polarity, one on the biphasic. I'm going to go on either side of the scar, about 1/4 of an inch outside the scar itself. And I'm going to push the buttons, and I'm going to count on 10 beeps. Then I'm going to move down 1/4 of an inch. And I'm going to count out 10 beeps again. I'm going to keep doing that all the way down the scar, moving in 1/4 of an inch increments. You'll notice I'm actually not on the scar itself. I'm actually on either side of the scar. So I'm just going to keep doing that. So what it ends up looking like is something like this. Now, when you get to the end of the scar like that, I like to switch the units from one hand to another. So now I got a different polarity on either side. And then I'm going to count out 10 beeps again and then work my way all the way back to the top. Then when I get to the top, I'm going to switch one more time. I'm going to go all the way back down again. Again, 10 beeps at each. So what we're doing is we're playing ping pong with electrons back and forth through this tissue. We're just bouncing electrons back and forth through there. This is 100% a game of electron tennis, if you will. The more electrons I bounce through there, the more it's going to change the polarity of this tissue in there. And that's what's going to make the changes. And by the way, those changes are permanent. So whatever outcomes you get from your scar treatment, like that's a done deal. Unless you re-injure that area, like actually injure the tissue, whatever change you get in that scar tissue, it's released. So if it's released 20%, you can come back in 6 months from now and do another scar treatment on it and get even more of a release, but you're not going to lose any ground. So I could do, people say, well, how many treatments would you do in a week? Like 2's good. You know, once you do a scar treatment, you're going to notice that it actually continues to change for about 72 hours. So those electrochemical changes, it starts kind of a cascade. So what you get today, it's actually going to be a little bit better tomorrow, and sometimes even the next day. And you're not going to lose ground after that. You're just not going to gain anything. So twice a week seems to be good. I tell people to count out 10 beeps down, 10 beeps up, and 10 beeps back down. So that's 3 passes. for a total of about 30 beeps. That's kind of the bare minimum. So when I do this stuff professionally, because I target plastic surgeons and people like that when I do my marketing, because these guys make scars and they make good looking scars, but that doesn't mean those scars don't hurt. And that doesn't mean those scars don't cause problems. And the nice thing about dealing with plastic surgeons is most people who see plastic surgeons, well, they have like $15,000 to do a facial or whatever. So if they have the money to do that, then they have the money to pay you cash to fix the pain that they caused by getting those scars in the first place, as opposed to somebody who used their last dime to pay for a knee replacement and now they got all this pain. Like, hey, we can treat this guys for free, but you got to make some money somewhere along the line, right? Okay, so I generally figure it's going to be about 5 treatments for most surgical scars to get good change in them. So I tell my patients 1 to 5 treatments. The first treatment I charge usually $150 for. That includes pictures, evaluations, all the little things I do, measuring the sensitivity of them. And then after that, it's about $90 for follow-up treatments. And those usually take 30 to 40 minutes a piece. Obviously, I spend more than 10 beeps per point going down those. I'll spend an enormous amount of time going around these scars. And the more you do that, the better it's going to be. And then I do also do some manual therapy, some gua sha, and some stretching. There's a lot of things I do to the scar. But my primary outcomes, like the main thrust of what I get, is out of these. Like that's where most of my outcomes come from. And then after that, the rest is just kind of finish the area out. So that's basically how to go about doing a scar. What if your scar is more like a circle like this? Let's say it's like a burn scar like that. What do you do with that one? Can't really go up and down on that one, can you? And here, where I live in South Georgia, we have a lot of mills that process wood for various things. The batting from diapers seems to come from the pine trees around here. It's the best batting in the world for diapers that comes out of our pine trees, just so you know. All right. So you don't want to go up and down on this. You actually want to work around this scar like it's a clock. Does that make sense?
No.
So you just do circles around the scar, but you always want these 2 units across from each other, because you're just bouncing electrons back and forth through there. So still, you are just kicking electrons back and forth through this scar all that you can.
Okay.
And the more you do that, the better it's going to get. Now, whether you have this scar or this scar, once you're done with working around the outsides of it, then you're going to go into the belly of the scar itself. Okay? Like you're actually going to go onto the scar tissue itself. And then you're going to I treat 3 passes, 1, 2, 3, 10 beeps each. Or if I have this one, I'm just going to work my way through the scar tissue, just kind of randomly work my way through there. And I just want to make sure that I hit all the areas within that scar. Okay. Now, people say, but what if I just had a TENS unit? What if I just took pads and just stuck them on the scar? What's that going to do? Well, nothing, because electricity takes a path of least resistance. Scars are very resistant to electricity. So if you put a pad on here, electricity is just going to go around the scar. That's why we start on either side of the scar, because we're pushing electrons back and forth through the scar tissue. Like it's a forced thing. You have to have two separate sources of electricity and different polarities to make that happen. Anything other than that, it just doesn't work very well. Okay. All right. So that's your little lesson on how to treat scars. I do a whole 2-day workshop on how to treat scars. We go over it in much more detail than that. We go over all kind of other cool techniques you can use. And those are in-person workshops. We offer them around the country. It's not always me who teaches them. We have instructors in other places. So we will send you guys emails if those are coming up. I do encourage you guys to come out for those workshops. They are a lot of fun, and you gain a lot more practical information from those. Okay, so now we need to talk about vagus nerve stimulation. So if you have a vagus nerve stimulation kit, please pull it out. And let's chat for a minute about the vagus nerve. So what is the vagus nerve? Well, it's called the wandering nerve. It's the longest nerve in the body. It kind of starts like in your brain on either side, sort of behind the ears, comes down, sort of comes together in here, runs all the way down to your gut. They call it the information superhighway between the brain and the gut. More information goes from the gut to the brain than goes from the brain to the gut. So they actually call it your second brain. It has a very strong influence over things like your overall level of arousal, like how ramped up your sympathetic nervous system is, which is your fight or flight response, or how calm your system is, or how well you recover from stressful events. So that would be things like hard athletic events, workouts, recovering from COVID, autoimmune diseases like MS and things like that. Or like a patient of mine today, I had a patient today who had shingles, and she's got she had bands of lesions all the way around through here. So we did vagus nerve stimulation to calm her system down, then did a lot of treatments with these, kind of like treating scars, and she left, she didn't have any pain. So that's pretty good, right? I used to work for a neurologist. I treated a lot of shingles. Actually, if you get shingles, if you catch it early, you can make the shingles stop. There are acupuncture points you can treat that will stop the shingles attack before it ever really gets started. So that's a good thing to know. All right. So vagus nerve stimulation. For vagus nerve stimulation, you're going to need one Dolphin Neurostim. You are going to need some of these cute little electrodes like this that look like this.
Okay.
You want to clean the face of this metal plate well. And the reason you want to do that is because we have to have these little oval electrodes specially cut to fit these. So they're a little more expensive than regular electrodes. And since these little oval electrodes are never going to touch anything but the face of this, if this is free of oils from your skin, you can use these pads over and over again. I'll get months out of one of these little pads. They last a long, long time. All right, so I've got one of these on here. In your kit, you also have some white wires, and they kind of come in two varieties. Let's see here if I've got one of the other varieties here. If you have an older kit, you will have ones that have two male connectors on the end of it like this. If you have a newer kit, you will have ones that have a male connector and what looks like a female connector, but if you look inside, it's not. It's just a shrouded male connector, okay? So it doesn't matter which variation you have. They're both the same. All right. So we're going to connect this to our little oval electrode right here. Connect up our white wire. Make sure we got a good connection there. And then you have a package of electrodes that look like this. Nice triangular electrodes. Rectangular, sorry. And if you're using these on yourself, and you can use these over and over again, but how long they last depends on how clean your skin is. So again, alcohol wipes, or you can buy those little cotton pads and pour them in a glass container and pour some alcohol on them, but clean your skin really well, and you'll get several weeks out of one of these pads, okay? So you're going to clean that area, and you'll notice that with your device, there is a nice little vagal skim grounding applications, like how to set this whole thing up. So there's instructions right there. The other thing you're going to need is one of these black cables that has a male connector on one end of it, and it also has a metal cup on one end. If you look, there's a metal plate in that cup. You're going to take that and push it over the end of the unit. The tip of this unit has to touch that metal plate. So you want a nice firm connection there like that. And now what we want to do is to put an ear clip on this. So we have a rectangular electrode on the white cord, and the white cord runs to the unit. So we've got this set up here. And then we have this black cord that runs to a male connector, and you'll have a little bag that has some ear clips on it. And these ear clips come in sort of different varieties. There are some white ones and some black ones. If you have, so this is what you're going to have. The black ones have a little metal plate on them. Sometimes you'll see some white ones with a metal plate on them. Okay, so there's ones with a metal plate on them. There are ones that have, and they're typically white, that have a conductive rubber tip like this on it. And you'll notice this is flat. And then most recently, like if you have a very recent one, we have what are called dome electrodes. And see, this is a bigger See the difference between the two?
Mm-hmm.
And these, if you don't have these in your kit, you're going to want to order some. They're not terribly expensive, but they really come in handy for this vagus nerve stuff. We actually designed these for vagus nerve stimulation because we're running into problems for you guys. All right. So where you want to, whichever you choose, you want to take your, the other thing you're going to have is what we call a splitter wire, a Y wire like this. It's got female connector on one end and two male connectors on the other end. I'm not going to connect this right now. I'm just going to show you guys how to use this part of it. Now, some of our older vagus nerve stimulation kits do not have this. Okay, so if you don't have this, you can order one from the company. No big deal there. They're about $10. So I'm going to pick the ear clip that I want. I'm going to put it on there. To target the vagus nerve, there has been some recent research that came out like very recently, and they did MRI studies of the ear to figure out what areas of the ear have the most surface nerves that connect to the vagus nerve, basically. And so what they decided from doing this study was that the most conductive area for the vagus nerve is the tragus of the ear. That's this little flappy thing right here. So if you kind of go like this, that's the tragus of your ear. Okay. And that has the highest concentration of nerve endings for the vagus nerve. So you would want to put this on the inside of the tragus. The problem you will notice is that it comes off a lot. Like it just doesn't stay on there very well. Okay. And that's almost everybody. But the other area is what's called the upper concha. So that's this area above here. So you got the little flappy thing, the tragus. And if you kind of run up in here, this is the upper concha of the ear. So this is going to go up in there. So this, I use the dome electrodes for this, so it actually fits up in there. And just want to make sure that you got good skin contact up in there. Now, once you do that, actually before you do that, you need to make sure that this is wet, okay? So if you use these little metal ones, these are highly conductive. These little metal clip ones are much more conductive, but they don't really have a dome on them. And we do recommend that you moisten them, but if you use either one of these absolutely have to have a conductive medium on them of some kind. So you can use electro gel. I like to use just plain, I just use hand sanitizer. It conducts electricity well, and it sanitizes things. So like you're in a good place with it. So really you'd want to take a little bit of that and just kind of put it on here and then put it up in the upper concha of the ear. And then this electrode, there are a series of 3 acupuncture points on the wrist right here that are calming points. And you will notice if you look at our diagram, we do have 2 possible locations. One is on the wrist and one is below the belly button. So we're going to do this wrist hookup. This is what I use for most of my patients. So I'm going to take this, and you can either go this way with it or this way. Either way works. Now, once I've got that on, I'm going to turn this Dolphin Neurostim on. And I have a high pitch, and you'll notice that the light isn't on. Remember when we found acupuncture points earlier, the light went out? That tells us we have a good connection. So this tells me I have a good connection because the light is off. But if I disconnect this, see what happens?
Oh, there we go.
So I want to make sure that this is firmly on here. Or if I have a problem with the electrode in my ear, this will turn on too. Okay. So once you have this connected properly, the light should go out. And now you have 2 choices. You can either hold this button down for as long as you want. You're going to have it on the negative setting. But that's really a pain in the neck. The best thing to do is to push this little button right here, which is going to put this into a silent mode. And the light may blink on the back. It may not. Remember I said don't look at the light. And it's going to run for 11 to 13 minutes. And once it's done, it's going to revert back and nothing's going to be going on. It's going to be in search mode. So at that point, you can either push that little button again to restart the treatment, or you can turn it off if you've done enough treatment for the day. You can also go below the belly button. Like in the diagram, the vagus nerve does run all the way to the gut. And so you can actually run from the ear all the way down to the gut. That's a good way to do it. We do recommend doing all this left ear, left side of the body. If you choose to do the right side, we recommend putting it in the same location and putting the device on the positive polarity. So Dolphin Neurostim needs to go on positive.
Oh,
I do not recommend doing that for any more than about 5 minutes because it tends to ramp your system up. Um, Definitely don't do 5 minutes before you go to bed unless you just don't like sleep. Um, Now, some people are more or less sensitive to vagus nerve stimulation. The first time we do treatments with our patients, we tell them we actually do it at the clinic and we do a 5-minute treatment, and that's it. We just want to see how they tolerate it. Most people barely feel a thing. Some people, however, are very, very sensitive to vagus nerve stimulation, and it makes them very sedate. So, in that case, that's a person you want them to go very, very slowly. So, our recommendation is this: do 5 minutes and then just leave it alone for the day. The next day, do 10 minutes. So, you add 5 minutes a day till you get somewhere between 20 and 30 minutes of treatment. That's usually enough for most people, unless you have something really acute going on. So, what's an example of something really? I'll tell you how I use this, okay? So, profile. I'm 53 years old. I raised 2 children by myself. Um, I work a lot. I work here treating patients. I do these online seminars for you guys, and I travel around to medical conferences lecturing and teaching workshops. So, I'm busy a lot. So, my life is kind of stressful. So I'm not 20 anymore. My system is like not as robust as it used to be. So I find that if I do vagus nerve stimulation twice a week for about 30 minutes, that's enough for my system. But when I had COVID, and I had it back and it was the Delta variant, the bad one, I was monitoring my oxygen saturation every day. And I had this whole stack of Chinese herbs I was supposed to take and all these supplements I was supposed to take. Like really did my research, had everything lined up, and was doing great. I was doing vagus nerve stimulation. I was taking all the herbs I was supposed to take. But if you've ever taken Chinese herbs, like those are nasty. I've never had them that are good. So on day like 5 or 6 or something like that, like I had a headache, but I decided like I was doing okay. So I was just gonna skip my herbs. So I didn't take any of the herbs that day and I didn't do any vagus nerve stimulation that day. And I woke up the next day, my oxygen saturation had been around 91 or so, which is not great, but it's not awful. I woke up the next day, my oxygen saturation was 80. I thought I was gonna die. Like, it was bad. And I was really worried that the ambulance was gonna have to get me from my own house and my children were gonna have to watch me go to the hospital. So I took a Dolphin Neurostim, hooked myself up, and after about 2 hours of steady treatment, my oxygen saturation started to come back up, and I did eventually get it back up to around 91 or so. So, very, very useful tool. What does vagus nerve stimulation do? So, vagus nerve stimulation acts as a neuromodulator. It influences your vagus nerve activity, which is your sympathetic and parasympathetic nervous systems. Sympathetic nervous system is your fight or flight response. That should be on roughly no more than 30% of the day. Okay. So the parasympathetic nervous system, which is what they call the rest and digest side, your nervous system should be on the parasympathetic side at least 70% of the day. And if it's not, that's not good. Okay, that's a bad place to be. That means your system is overstressed and you're never recovering properly from things you need to recover from, and you need some help. So, when you do vagus nerve stimulation, what actually happens? Well, there are some measured things, and we have got a whole list of hormone changes that we know happen when you do this. So, the short list is this: cortisol is your stress hormone. If you do vagus nerve stimulation, it can drop your cortisol by as much as 50% in just a few minutes. So, it's tremendously effective. And also, there are a lot of sort of equations you can apply to extrapolate numbers out of an EKG. One of them is something you may have heard called HRV, which is heart rate variability. It's something that's tracked a lot in elite athletic circles. If you look up heart rate variability online, there's tons and tons, just literally thousands of studies in like military applications and diving and sports and even racehorses and all kinds of stuff. It's a measure. It's a measure of total power of your autonomic nervous system. It's how well you can resist incoming stressors. So that's your sympathetic nervous system. And B, how well you can recover from stressors like being sick. So it's a measure of longevity. So the higher that number is, the healthier you are. The lower that number is, the more you're screwed. So you've heard about people going to the hospital and getting a stress test before an operation. Like, let's say you're like, I don't know, like 94 and your doctor decides that you need a hip replacement for whatever reason. You go do a stress test at the hospital and they look at those numbers. If your heart rate variability is high enough, you're good to go. But if your heart rate variability is too low, the doctor may say, look, you need this hip replacement, but we don't want to do it because your heart rate variability is so low. We're afraid that if we stress your system anymore, you're not going to be able to respond. You're going to die on the table. So it really is a measure of longevity. So doing vagus nerve stimulation will raise your heart rate variability, not your heart rate, but the time variance between beats. And that's a really important thing. So that's number one. The other thing it will change is your high frequency vagal tone. And that's a measure of your rest and digest functions. Like that's the parasympathetic nervous system. So that's your ability to recover from events that are very stressful to your system. So that's when you're sick or have worked out. So we have a lot of elite athletes who use this. We got boxers, MMA fighters, distance runners, and stuff like that. And if you train too hard, you can actually go into what's called overtraining syndrome, OTS. And when you're into OTS, your heart rate variability drops so low that you can't recover from your workouts. And so what happens is you don't get faster, you don't get stronger. Your system just starts to degrade, and that's a real risk for people who are who do high intensity workouts all the time, and for distance runners, people like that who don't work out like 2 or 3 times a week. They're working out every day. And if you go into overtraining syndrome, you have to take a break for like 3 days. However, if you do vagus nerve stimulation immediately after your workout, you can go work out the next day and you're fine. So it staves off what they call basically that post-workout soreness stuff that people get. Like it cuts that out tremendously and really helps you recover. So it's a good tool for that. It is a great tool if you are ill. It reduces systemic inflammation. So if you have anything systemic inflammatory condition, vagus nerve stimulation will help bring that down. Whether it is something like toxic mold exposure, you can do a lot of vagus nerve stimulation if you've got that. It helps bring down the inflammation in your system so that the other integrative treatments will actually work, because a lot of times they don't work. Your system is so flared up. It actually works quite well. I have a number of friends who have autoimmune disorders, and again, you have a system, you have a situation where your body is attacking itself, it's inflamed, and it's a way to bring that down so you can stop acute attacks of whatever it is that's going on. So it's a very useful thing for people who have conditions like that. Vagus nerve stimulation is great for anybody who happens to have a migraine headache. If you have a migraine headache and you put vagus nerve stimulation on, then you are in a pretty good place, because it'll usually be gone in like 10 or 15 minutes. So it really does work pretty well for those kinds of things. Other things you might want to use vagus nerve stimulation for. I had a stepdaughter who was autistic. We did a lot of that kind of thing with her when she was younger. It works well to calm fear and anxiety. If you have a child who has a learning disability like dyslexia or something like that, there's usually a lot of anxiety with that. It helps bring that down significantly. So there are really a lot of applications for it. And it's just a general good maintenance tool. It doesn't replace using the right supplements. It doesn't replace, putting good foods into your diet and cutting out like things like sugars and wheat and stuff like that. But it is a really nice step towards getting you well if you've been quite sick. So that's the deal with vagus nerve stimulation. Now, you can use this Y wire. So you can take your black cable that has the single cable on here, single earplug on there. And now I can connect 2 ear clips on here. And I can put them around the greater, around the upper area right here in my ear, the upper concha. Or sometimes you can also do if you're feeling lazy, you can put them on the earlobes like this. But if you're going to do 2 ear clips, you need to take this unit and flip it over to the biphasic channel at the top. And you put on this biphasic channel over here so that it's flipping back and forth between each ear. So that's a time when you might want to use that. And you can use that for general applications. Really, for most of my patients, I'll do some left ear, and then I'll put this this harness on and do a few minutes of this as well to kind of balance things out. Again, with this, you want your white electrode down below the belly button. And so that's kind of the ins and outs of vagus nerve stimulation. So now we need to go over things like contraindications. When do you want to use this stuff and when do you want to stay away from it? So we're going to go over what I call Joe's rule of pencils, because my name is Joe and I have this rule about these things. So the first contraindication or rule is don't stick this thing anywhere you wouldn't stick a pencil. Simple. Don't stick it deep into your ear. Don't shove it up your nose. Don't stick it in your eyes. Don't ram it down your throat. Other than that, you're pretty good. So other things you might want to avoid, don't put this on top of your head if you have a history of seizures. There are acupuncture points that will stop seizures. I have seen that done and it works quite well, but they're not on top of your head. Even needles are contraindicated on top of your head if you have a history of seizures. Again, there are points for epilepsy. They're just not on top of your head. Things like plates, screws, joint replacements, all those kinds of things, those are fine. Those are not a problem whatsoever. You can use this on any kind of thing like that. Dorsal column spine stimulators, bladder stimulators, baclofen pumps, insulin pumps, all those are fine. Okay, those do not pose a problem whatsoever. Some of those stimulators, I have them turn them off just so there's only one source of stimulation, but it doesn't really matter one way or the other. Pacemakers and defibrillators, I would defer to the patient's physician. So in your little kit with the Dolphin Neurostim, there's a little guide that says professional use. If you open that up, there's a page that has the electrical parameters. Like there's a little diagram that's got little pluses and minuses and the waveform. Send that to the doctor and say, hey, I want to use this on your patient, yes or no. And they'll either say yes or they'll say no. Whatever they say, that's what you go with. Because they're the doctor, you're not. Other things you don't want to do. If you're using this on a small child, you can use these on babies. Turn it down on low. Don't do 30 beeps. Do like 5 beeps, because they're tiny. If you're going to use it on your animals, it's fine with horses. It's fine with dogs. It even works well with cats, but cats have to be pretty sick before they let you use this on them, and cats can hurt you. So keep that in mind. I did, however, work on a cat of mine that had kidney failure, and I kept her alive for a couple of years. So the vet kept thinking she was going to die, and she never did die until, a long time into things. So other things, pregnant women. I would just avoid treating a pregnant woman in the first trimester, because if somebody's going to have a miscarriage, spontaneous miscarriage, it will happen the first trimester. Something like 50% of all pregnancies actually end up in a miscarriage. Most of it's so early you never even knew you were pregnant to begin with. But you don't want to be the one weird thing that happens on the day that somebody has a miscarriage. So I would avoid the first trimester. Avoid points around the inside of the ankles in general. Again, defer to the physician, but there are points down in here that are used to set off labor, and they can do it quite effectively if the person's ready to go into labor. Don't treat on top of the head if somebody's pregnant, because that pushes energy down. We're not trying to push a baby out. Don't treat on top of the shoulders right here. This pushes energy down. We don't want to do that. Don't treat large intestine 4, that point we were showing you guys earlier, for headaches, because this is known as a great eliminator. We're not trying to eliminate somebody's baby. Don't treat directly over the tummy. In OBGYN offices where I have worked, I have seen them prescribe TENS units to put pads on people's backs, and they were okay with us doing this on the patient's back. Again, doctor's orders. But don't put electricity over a gravid uterus. That's a no-no. If you happen to treat somebody, because I have gone through, like an hour's worth of treatment on somebody, only to have them come back a couple of days later and say, oh, guess what? I just found out I was pregnant. And I've treated every acupuncture point you shouldn't treat, every, one that's absolutely taboo. And guess what happened? Nothing. The reason nothing happened is because it was a perfectly viable pregnancy, and you're not going to overcome the homeostasis of pregnancy that easily. I wouldn't go do it on purpose, but it's happened before. So don't get all worked up about it. Like if they're okay when they leave, they're probably going to be okay. Other things. There is let's see if I can find one. There is a strap you can get if you have a hard time getting skin-to-skin contact with your patient. You can order one of these straps from Acumed. You put one of these on your wrist. You put the other on your patient's wrist. And now all I have to do is touch this down on the patient. I don't have to have skin-to-skin contact because we're connected electrically. Does that make sense? You guys nod your heads if that's a yes. Okay. So you can, these are about 25 bucks. They're cheap. They're not expensive. There is also kind of what looks like a wand. Let's see if I've got one here I can show you. Like this in your equipment. Looks like this. You put this on the end of the Dolphin Neurostim like this, and it is a home treatment device, so you can get points in your back that you otherwise couldn't get to. You can tape this to a back scratcher, and this is bendable. So you can bend it to whatever shape you need. Wow. If you're treating children, this is a good way to treat acupuncture points in their ears without getting noise in their ears. When I worked in women's health, we would use these. They're about $25 a piece. We'd have the patient buy these, and we would actually use these to treat scars in places that you wouldn't want to stick this. So sometimes people get some scars during delivery that are in places that you wouldn't want to put a device you were going to be putting other places. So we would make the patients buy these. We would use these. They take them home and clean them and bring them back. Let's see. Any other major contraindications I can think of? I don't think so. So why don't I take a few minutes here and go through questions here and see what kind of questions you guys may have asked. Can you treat over hardware, pins and screws? Absolutely. Is there any guideline for how many weeks after surgeries it's okay to use either for pain or for scars? Actually, there is. Immediately. Because one of the things that this does that we haven't talked about is low frequency direct current that's a monophasic square wave, somewhere between 1 and 3 hertz at a 50% duty cycle, anywhere between 80 and 800 microamps. Will increase ATP production. ATP is adenosine triphosphate. It will increase ATP production 400 to 500%. So it supercharges healing. I've had friends with non-healing diabetic ulcers in their feet who failed in wound care at the hospital. I don't do wound care, but I treated them and I got tissue granulation in your feet. So this works really well for healing things. And the faster it heals, the less the chances are you're going to have scar tissue in that area. It's also very good. Now, you're not going to stick this in an open wound. That's another contraindication. That's kind of in the rule of pencils. Like you wouldn't stick a pencil in an open wound. Don't stick this in an open wound. Okay. But you can treat around that area, just like a scar. Just treat on either side of it. And if there's a dressing there, just go on the outside of the dressing. Just work along those areas and you're good to go. All right. So let's see what other questions we have here. Will this be sent to us afterwards? It absolutely will. You guys are going to get a link to it. You can watch it as many times as you want. What about wires after open heart surgery? Does it have impact or effect? Should we avoid the area? No, you can treat it. You can treat it. It's fine. You can probably even treat directly on the wires. It'll just direct the current down into the area that's wounded. So it's not going to hurt anything. Turn the lights out. Maybe get some fun sparks or something. Although I've never seen any sparks. So probably not. But you know, you could always hope. Let's see. What else do we have here? Is there anyone in Pennsylvania? Yeah, there's lots of people in Pennsylvania. If you contact the main office especially if you get on the Facebook forum, they can tell you who's up there. In Ontario, Canada. Well, these are made in Toronto, 100% in Toronto. So if you're in Ontario, yeah, there's a bazillion people up there. We're teaching workshops there all the time. So absolutely. Would it be the scarring with wisdom removal or the area outside is numb? You can treat over the area here, or you can use these extension probes and treat inside the mouth. That works. Some therapists in Pennsylvania are telling me I can't advertise. this service because it's not in our scope of practice. Depends on what you do for a living and also who you're working for. Like if it were not in your scope of practice, but you were working for somebody who it was in their scope of practice and you were working as an electrotherapy technician, like for example, like a chiropractic assistant, you might be able to apply it. I don't know the laws in your state. You have to look into it. Are there contraindications to doing scar treatment on patients with cancer? Also on patients who are in remission, but who have a bunch of scar tissue for lymph removals? All right, good question. So you probably wouldn't want to do this over an active cancerous tumor because this does increase protein synthesis, it does increase cellular membrane transport, and it does increase ATP production. So theoretically, if you had an area of uncontrolled cell growth, you could theoretically grow more cells faster in that area. Now, I will follow it up in saying this does not have an indication for treating cancer of any kind. There is, however, a microcurrent system on the market that is used for shrinking brain tumors, and they use low frequency direct current to shrink brain tumors. So draw from that what you will. If the patient is in remission, they're fine. They don't have cancer. So you're good. You're not going to make cancer where there's not cancer. And absolutely, each of those scars that they have after cancer surgery is a stressor to their systems. The more stress you're under, the greater the chances are you're going to have cancer. Like I have a patient who was in remission for years, and then she went to a terrible family reunion. I mean, she was in remission for like 6 years. Then she went to a terrible family reunion. There was a big fight there, and within a week she had cancer. She was dead in 2 months, like just that fast. So stress is really bad for people who have cancer, and scars affect the autonomic nervous system and stress your system. So yeah, so scars you would definitely want to treat. Some safety questions. Any chance of burning or injury with high intensity or choosing the wrong closed circuit points? No, you're not treating your points long enough to get burns. Any minimum age to use? No minimum age. We actually did a workshop at Old Children's Hospital in Tampa. They were using this for spasmodic torticollis in babies, Rhynic, with their heads are like that. It works fine. I have a half moon scar on my head when I was 5. How do I treat that? Well, as a half moon then, it may be only like a quarter of a moon now, but you would treat it just like any other scar. You're going to go on either side of it and just work through it. Use 2 units and just work down through the hair, and you should be fine. I have seizures, but not major, just occipital from multiple chemical sensitivity. Can I work on the scar on my head? I had a guy in one of our workshops who had toxic mold exposure, which is chemical sensitivity. And he told us ahead of time. He worked in an office for like 2 years. It was just eaten up with black mold. And he actually started having seizures because of it. And he actually had a seizure in class, and we had to treat his seizure. It's a point on the bottom of the foot called kidney 1. Good one to learn. And it did stop his seizures. We were able to treat him throughout class with this, and he didn't have any problems. So here's what I would say. I would say that the best thing to do would be to treat on that scar for just a minute, just like 20 seconds, and see what happens. Like, chances are nothing's going to happen. And then just add, if it were me, I would add just a little bit at a time. You know, don't go do a full scar. I wouldn't do a full scar treatment on myself the first time. Like first I would treat some points on my hand and see how that works. If I was okay there, then I would treat some points closer in. Then if I was there, I would treat. That's what I would do for myself. So, you know, if you have any serious concerns about that, you need to consult your physician about that. But if it were me, that's what I would do for myself. Okay. Does the sound come back on automatically? I've tried this, and the device I have do not resound after 15 minutes. Well, probably what's happening is that it's reverting back to the search phase, but because the search phase is a circuit, it's a very, very high pitch. So probably the light's not on. And so you're probably good. Just reset it and you're good to go. If you were to pull the ear clip off, I suspect you would hear sound again very quickly. What about a person 13 years after catastrophic traumatic brain injuries, many fractures, hydrocephalus versus VP shunt, scar release thoughts? Yes, we have a whole concussion brain injury protocol that you could do on this. It's a really good workshop. I do recommend it highly. And yes, there's a lot you can do for someone like that. I have treated brain injury patients. I used to work for a neurologist who did brain surgery, and we would do this directly over the areas where they had brain surgery. It seemed to work quite well. Again, always go slowly. It is, after all, the brain. Is there a difference on settings or points we should know or change based on the acute or chronic stages? Just look at the condition. If it's excessive, you want to bring it down. The tricky thing is figuring out what's excessive and what's deficient in acupuncture. So, for example, what about constipation? Is that excessive or is that deficient? Well, that's actually excessive. It's too much tone. So you want to get rid of that. So you would put this on the negative setting and treat the constipation points, which are on the wrist. What about diarrhea? Is that excessive or is that deficient? Well, that's excessive too. So constipation and diarrhea are both excessive. And in both cases, you would actually want to use the negative polarity. So it's a little bit of a, if you don't grow up with it, it's a little difficult to understand it. So refer to the manuals. Let's see here. Does a person have to remove hearing aids? Not if you don't want to. Just depends on how close you get to them. You know, if you like high beeping noises and you get too close to it, you're going to get some interesting sounds. Can I treat 2 points at the same time? Absolutely. Most advanced workshops, we treat 2 points all the time. The magic in acupuncture isn't single points, it's combinations of points. That's called a circuit in acupuncture. So absolutely 2 points at a time. One dolphin does not seem to turn off for 17 minutes, the other for 12 minutes. Does that mean 17 minutes on one has a weak battery? Probably so. It's probably just a battery issue. And that timer isn't set to be an exact thing. It's just so you don't overtreat yourself. You still want to set a timer. Have you ever had a negative response from a client when they were aggravated in an area for over a week post-treatment? Generally, no. Sorry, my children are texting me from the house. Okay. Generally, no, but if you want to like get a little more detailed with that in our Facebook forum, we could probably look into it for you and kind of figure out what's going on. Any rules or tips for choosing circuit points? Really, any combinations of points work quite well together. You're really not going to go wrong. If you treat one acupuncture point, it doesn't change the electrical resistance of any of the other acupuncture points in the body. If you treat 2 acupuncture points at the same time, the electrical resistance of every other acupuncture point in the body goes down. So something systemic and important happens there. So any 2 points you choose are going to be good. But you might treat 1 point because the patient's depressed and another point because they have pain in an area that's driving it. So there's a whole lot of reasons why you might treat points. You might treat 1 point to pull energy to an area, another point to disperse energy from another area. There's a million reasons why you might do circuits. So there's actually, we do whole entire classes on circuits. Is there an additional protocol book I can order? I mean, this comes with your unit. This is a ton of protocols in here. Like that's a lot of acupuncture protocols in that book. There are other books. Typically they come with classes that we teach because they are specialty classes. Can you use 2 dolphins on a wrinkle, positive on both to help remove wrinkle or Bell's palsy? Okay. So I have a friend of mine who will treat stretch marks on people, which is basically kind of like a wrinkle or kind of like a scar. And he will treat half of a stretch mark for you for free, but he charges you for the other half of the stretch mark once you see how well it works. So if you're treating a wrinkle, what are you doing? with like Botox. You shoot Botox into the wrinkle. What does it do? It relaxes the muscle. What happens if you stick this inside of a wrinkle? It relaxes the muscle. So yes, it reduces the appearance of wrinkles. It actually works quite well. There are a lot of people who use these for aesthetics, for acupuncture facelifts is what they call them. Are there good bladder inconstancy points? Yes, actually. So if you've got bladder issues, you want to treat on the low back because these are the nerves that go to the bladder. So you're going to treat what are called the shoe points here. Then there are urinary incontinence and constancy points over the bladder in this area. And there's some points down around the ankles you're going to treat, like spleen 6 and kidney 3. So there are actually a whole host of points for that. Okay. Some acute low back patients cannot be in prone position for low back protocol. Could we do it in sitting? Yes. I treat patients in seated position all the time. I treat them in sideline. Also, sometimes I use sacral blocks. You can order them off of Amazon. And I use what's called a category 5 blocking technique that is for hot disc issues. When you put them under their hips at a specific angle, it takes most of the discomfort away. But you can treat them seated. That's fine. Not a problem there. Any points for acute low back pain with numbness, tingling in the legs? Always start with the spine. If you got carpal tunnel syndrome, start with the neck. If you got anything below here, like knees, ankles, whatever, start at the back. Always start with the spine. I don't care if they don't say their back hurts. Always treat the spine because it originates here and then goes out from there. If you have no idea what you're doing, you can take this and stick it where it hurts and it will feel better, generally speaking. But it's not going to stay better. Microcurrent will make it feel better if you follow the protocols. Those are designed to get you more long-lasting outcomes. Can you explain how this device is different than PEMF, pulse electromagnetic frequency? Well, PEMF doesn't change heart rate variability as much as we do. PEMF is usually a series of pads that people use. They work pretty well. This is different because PEMF is generally a lot more expensive than this. And you can't treat specific acupuncture points for this. So PEMF is useful. It just doesn't really do the same thing that this does. You can't treat points with that. You can't treat points with this. It's a different theory on how things are working. Can you use this to treat muscle tears? Then it increases ATP production. If so, what would you use? Yes, you can use it for muscle tears because it does healing. I would treat it just like a scar. Negative on one side, biphasic on the other. You could put it on positive of the area too. That wouldn't be bad. Either way, you're bringing energy into the area. If you experienced a negative response, if so, what would you say or do? I've had cases where I've aggravated conditions that patients have had, for sure. Because if you release one area, and like, I'll give you an example. I was in a workshop. It was a scar workshop. There was a physical therapist in the workshop. When she was a child, she had her foot almost completely amputated by some farming equipment. They sewed it back on, and they told her she would never walk again. That's what they always tell you. And then she got all pissed off, and she set her teeth, and she learned how to walk again. She became a physical therapist because of the whole thing, and this has been the story of her life. But anyway, she had a ditch in her backyard. If she could just jump over that ditch, it would make her happy. So one of the students in class decided to treat the scar around her ankle where she had her foot amputated. And he did. It released it very well. It released it so well, in fact, that her foot was floppy, like it wouldn't do what she wanted it to do. And she absolutely flipped out because her greatest fear had just come true. She was never going to be able to walk again. The problem is the scar tissue had been doing all the work for the last like 30 years, and the muscles hadn't been activating. So we treated a series of acupuncture after she calmed down for a minute. We treated a series of acupuncture points in the area and got the muscles activating, and then she was fine. So if you treat an area with a negative and it aggravates something, put the unit on positive and go back and retreat that area. If it's a migrating pain that moves around the body, you want to treat a wind point, gallbladder 41, right down GB 41. That's a great point for migrating pains around the body. So yes, there are ways of dealing with things like that. Can you use on patients with spinal cord injury who experience lots of neuropathic pain as well as pressure ulcers. Yes, you can use this around the pressure ulcers, and you can use this for people on spinal cord injuries. The really interesting thing is you can have somebody who is a paraplegic, can't feel their feet, can't move their feet, but the acupuncture points down on their feet still work to affect their head. So meridians don't run through the nerves, they tend to run through the fascia. That's where the acupuncture meridians run. So yeah, you can use it on those people. I used to work for neurologists and treat people like that all the time. Have you ever used or experienced vagus nerve stimulator or acupuncture points for scalp psoriasis? Well, scalp psoriasis is basically because your chemistry is psoriasis, your chemistry is kind of off. So yes, this will help stop systemic inflammation and should help. However, you probably have a crappy diet. You probably have a leaky gut. You probably need to deal with those things because your skin is an indicator of things going on deeper in your body. Skin problems are an inside out problem. They're not an outside in problem. So there's something systemic going on with driving it. However, psoriasis is driven by stress responses. So I would treat all the scars. I would treat the appropriate acupuncture points. And yes, you should see the psoriasis calm down some. If the client has lost nerve and muscle tone from radiation therapy, would you use the positive setting? Yes, that's actually a really good thing you could do. You can use the positive for that. Do keep in mind sometimes they have deep burning from radiation. And in those cases, sometimes you need to look up water points. An example, I had a patient who had breast cancer and they didn't do surgery, but they did radiation on her breast. She had deep burning in her breast. If you treated over the area, it would just piss it off. But if you went down to the foot, to the stomach meridian, treated stomach 44, which is a water point on the stomach meridian, the stomach meridian runs up and runs right through the breast. Water cools fire. So those water points would actually cool down the pain up in here. So water points are a good thing to learn in acupuncture. What else have we got here? We only got 2 minutes left, so I'm going to get through as many as I can here. In your experience, how many times should you feel like you need to do a protocol to see results? If you come to see me with any kind of pain, my expectation is 90% of the time I will get rid of your pain by about 50% on the first visit. It may not stay gone, but I can usually knock it back considerably. This is a very, very fast modality. How do you find out all the points to treat gallbladder 41? Just get on the internet, type in acupuncture point, gallbladder 41. There's tons of acupuncture. There's whole programs for that kind of thing. What point would you do to treat a migraine? I would use Heart 9 on the finger. That's acute vascular emergencies. It's supposed to be for heart attacks, but migraines are vascular, so it works well for that. I would treat gallbladder 41, which is a wind point because migraines are a wind problem, and I would do vagus nerve stimulation. All right, so we are at 9 o'clock. So we have done a full 30 minutes of instruction here. My children are